The MedSearch app is a health information directory that allows users who are in search of specific medications or health services such as hospitals, clinics, pharmacies, or even veterinary services to quickly and easily access what they're looking for. It's available on Google Play Store and you can find it on Apple App Store.
It's Valentine's Day, but not only is it Valentine's Day, but it is International Epilepsy Day. A day where we increase awareness about what epilepsy is all about. How do you manage a person with epilepsy? The theme for International Epilepsy Day is show some love. Show some love to people who are stigmatized with the condition that they have. Joined today as a special guest all the way from UK. She will introduce herself and we'll go on to discuss different areas about epilepsy. Evening.
Good evening. How are you?
I'm fine. How's been the day?
The day's been all right. It's been a busy day at work, but yeah, it's been okay.
All right. So I'll give you this opportunity to introduce yourself and tell us something about what you do, where you work from, so that people know whom they are listening to.
All right, okay. So my name is Khetasa Chiwowa, and I'm a clinical physiologist. So I work in the Department of Neurophysiology in the NHS. So with neurophysiology, the main thing that we do is diagnostic tests, and those diagnostic tests are on the nervous system. So we do tests on the brain, which
Oh,
is where epilepsy comes in, because we do a test known as an EEG or encephalogram, if you want to say the whole word.
no.
So with this test, it's something that's not available. Yeah, it's something that's not readily available in Zambia, but hopefully it's something that people will have more access to because it's very good at picking up not just on epilepsy, but just the different types of epilepsy, because it's something that people don't really understand that much about. I mean, there are different types of seizures, and this test is very good at picking up on them. So that's what I do in a nutshell. I work in neurophysiology and I look at different brain conditions, including epilepsy.
Uh, One question that was on my heart was why did you choose neuroscience apart from other condition? You went and you like fallen in love studying the brain. Why? Is it something that happened to you, maybe a family member, or you just found it interesting?
The thing is, when I went to uni, because I went to the University of Leicester, I specialized in biochemistry, but then I wanted a job that was applicable to, like, let's say, just something that was patient focused. So I did the scientist training program. And with the scientist training program, they had different areas. So you could do cardiac, you could do respiratory, you could do sleep studies. But for me, the most interesting one was neurophysiology, like everything that's brain related,
Okay.
because it's just something that I feel people don't understand that much about. And it's an area, especially coming from Zambia, not knowing that much about epilepsy. It's an area that I wanted to explore in more detail and just be able to help people in that area. Because, like you said, there's a whole lot of stigma with people with epilepsy. But the sad thing about it is that there's actually medication for it. So it's just good to be focused on that area. Well, that was my interest anyway, just anything brain related.
Uh, Apart from stigma, we have okay. Yes, at the end of the day, there's always stigma, but we go on to see a
Mm,
lot of misinformation. You and I were joking earlier before we
yeah,
started recording. We were talking about how other people just feel
yeah,
like this is just someone, or if you see someone with epilepsy, then definitely they are demon possessed with the
yeah,
way the person would be.
yeah.
The Yes, so many misinformation. So we
Mm,
hope that we'll be able to learn something today. Today is
mm.
International Epilepsy Day. Why is this day so important?
So this day is really important. Like you said, people do have all this misinformation. Like you said, people are going to say, oh, yeah, epilepsy is as a result of somebody being bewitched. But I feel like that tends to be, they tend to go for an alternative explanation, which are unfortunately in Zambia and many other places tends to be stuff like, oh yeah, somebody's just bewitched and that's what's causing them to have seizures. So it's really good for this state to be able to raise awareness and say, okay, this is something that's a result of being bewitched. And because you understand that it is a brain condition, you also understand that it's something that there's medication for and it can be treated. And as a result, it just allows people to live as best a life as they can. Because the thing is, the problem is that when people do put the stigma and say stuff like, oh yeah, it's as a result of witchcraft, they don't get the appropriate treatment and they don't get the management of the condition that's needed.
No.
So that's why days like this are really important for people to actually know that that's what it is, that it's something that's organic, it's something that you can't help, and there is medication for it.
Well, we're so fortunate that we have you today, and it will be great. Like, we're now giving you all our ears. So, what is epilepsy? What types of is there are there different types of epilepsy? How do you manage it?
Right. So epilepsy, like I said, it is a brain condition because what happens with epilepsy is that you get this disorganization of the electrical activity happening in the brain. So whenever somebody has seizure, it's happening in the brain, and then that's what causes the seizure. So the main types of seizures are what's called generalized tonic-clonic seizures, and those are the ones that people tend to see a lot because that involves the whole brain. So because it involves the whole brain, the person is confused afterwards. It might be that they have lost function of everything, and they are confused afterwards because it's involving the whole brain. So they don't remember what has happened afterwards. And there are different forms of epilepsy, just like you said. There's also other types of epilepsy called petit mal seizures. Those are what you see in children a lot, and that's where you get a whole lot of misdiagnosis. Because with petit mal seizures, you just get a child going vacant. Just like the child is just daydreaming, but it's not that they are daydreaming, they're actually having multiple seizures a day. It's just that they are not having what you'd call a seizure, like they're not having that full body jerking. They are literally just going vacant and just staring into space. That's why they come to the clinic a lot. Because even in this country, for instance, that's something that's it's not diagnosed as much because people tend to stereotype and say, oh yeah, the child is just daydreaming, but it's actually a form of epilepsy. And then there are other types known as focal seizures. So those just involve a part of the brain, not the whole brain. And with focal seizures, people do stuff like they've got deja vu, or they can have like hallucinations, so visual hallucinations, auditory hallucinations associated with that, or they can just have like fumbling of the fingers, just some motor activities. That's another type of seizure. So there are so many different types of generalized tonic-clonic seizures.
I'll try to bring you
Yeah.
back. I'll try to bring you back. Sorry, with part more epilepsy, especially in children. How can a parent know that
Yeah.
my child is having this is leading to epilepsy? This is epilepsy. How can a parent know? Because with an adult you're able to explain, but with children they can't give you proper feedback. So how would the parent
Yeah.
know?
Mm. With petit mal seizures, it's very difficult. They tend to be picked up at school a lot because then what
Mhm.
happens is, let's say they just have the vacant episode. Even if it happened in an adult, they'll just carry on as normal because then they wouldn't know that it's happened. For petit mal seizures, parents need to be like very in tune with what's normal and what's not normal for their child. They can't just put the stereotype of saying, oh yeah, that's just how they are, but they just like daydreaming and things like that. They need to, this is why days like this are important, because if parents know what they are looking out for, then they can know to say, okay, this doesn't seem natural for my child. And also in school as well, they tend to like lose concentration in school as well. So that's why it tends to get picked up a lot in schools. And then if that's something that the school picks up on, then the parents can address it and then go to the hospital and it can be looked at in more.
In more details. Wow, that's great. Uh, we've talked about part more. So, what causes them before we come to the signs and symptoms? What is the major cause for someone to start having different seizures?
Well, there's so many different things that can cause seizures. For some people, it's genetic. So
Okay.
some people are just born with it. Especially for like generalized seizures, it's just something that is just in the genetics. It's not something that you can help. So that's just something that people are born with. For other people, it might be as a result of because that's an area that's had brain damage, then that area is more likely to have seizures. And then for some people, it might be as a result of infection, like meningitis, anything that can affect the brain that can bring on seizures as well. And like I said, stroke can be another cause. So there's so many different things that can cause seizures. And then there are other things that can trigger seizures as well. So the
Okay.
main things that can trigger seizures is things like flashing lights. So for some people, they've got photosensitive epilepsy. So if they see like a particular frequency of light, like let's say, when you're driving down the road and then you see the can bring on a seizure because it's a particular frequency.
Yeah.
And then for other people, like those petty mouths, the ones I was talking about in children,
Children.
if
Yeah.
they're hyperventilating, so if they're breathing quite deeply, because they're depleting the brain of oxygen, that can bring on a seizure as well. Yeah.
Uh, there was a lady who had asked a question. Her child, he's a teenager, he was an alcoholic, and later
Mm,
on started,
yeah.
yeah, jerking. Is alcohol related to
Yeah.
someone having seizures?
Alcohol itself doesn't necessarily bring on seizures. It might be the case that somebody has got genetic epilepsy, like they say they just have epilepsy. The problem is alcohol makes the situation worse. It can bring on seizures. First of all, it can interact with the medication that they are taking. Let's say if they are taking anti-epileptic medication, or because of the dehydration and that upset of the balance. So alcohol itself does not cause epilepsy or does not cause seizures, but it can bring on that like flashing lights, lack of sleep, alcohol, all of those things can trigger seizures, but not cause seizures.
You've brought in one very important causing factor, which is lack of sleep. And I know there are so many entrepreneurs out there that
Yeah,
want to zero the night, sleep at
yeah.
04, and wake up at 04:30 and go on doing fighting as an entrepreneur. Why is sleep very important?
Or with the lack of sleep.
Yeah.
All right, okay. So the thing is, with epilepsy, it's a tricky one because as soon as you get diagnosed with epilepsy, there are things that you need to consider. Like alcohol is one of them. Like you can't be taking that much alcohol. Lack of sleep, that's another thing that can trigger seizures. So you just try and keep a balance with these things. Everything in moderation.
Everything in moderation. Uh, what are some of the
Everything in
signs?
moderation. It's all
Yeah.
about balance. It is all about balance.
What are some of the signs and symptoms? Like, how can one know to say I'm about to have an attack? Or how can one know, like we've talked about petimo in children, you've explained, but what signs and
Yeah.
symptoms should people be aware of?
The problem is, depending on the type of epilepsy that somebody has, some people can get a warning before they
Okay,
have a seizure. So
okay.
for some people, they can like have a funny feeling before they have a seizure. And if they do have a warning, then it's enough time for them to get themselves like in a safe position. Because the worst thing is, let's say somebody's standing up and then they have a seizure and then they fall down, and then that can end up with a head injury. But unfortunately, in some cases, sometimes people just don't get any warning with seizures. They just end up having the seizures. So the people around them, the main thing that I say is that they need to know how to handle that seizure. And one thing that is really upsetting about people handling seizures in Zambia is that they tend to put a spoon in the mouth, which is a
Yes,
very dangerous thing to
even
do. And I would
sticks.
advise people to not do that, please. Even a stick. Because the thing is, it's really scary because when you see somebody having a full-blown seizure, it's a scary experience. It's a scary
Very
experience
true.
for you who's seeing it. but it's not for them because they won't remember. It's their whole brain involved. They won't remember. And they tend to make like these gurgling sorts of sounds. And it looks like they are swallowing their tongue. But believe me not, like they will not swallow their tongue. Do not put anything in their mouth because you
Even
might
holding
just
their
cause
tongue.
injury.
Yeah.
It might
Trying to
just
pull their
cause more
tongue.
damage. Yeah,
Yeah.
what I usually say is, yeah, try to pull their tongue. Do not try to pull their tongue. They will not swallow their tongue. It's not possible. The main thing, the main thing with seizures is you want to make sure that the person is in a safe environment. You want to make sure that there's nothing there that can hurt them. Difficult as it is to do, when somebody is having a seizure, let them have the seizure. Like you just have to allow them to have it. And then when they are done having the seizure, then you put them in a recovery position. So with a recovery position, you're literally putting them on their side and
Okay.
then allowing them to recover and just making them comfortable. Because the worst thing you can do is try to put something in their mouth. Because imagine if they swallow it or something, and that
True.
causes more harm than good to the person. And then you also have to be aware about how long that seizure lasts for. Usually, as a guide, we say if the seizure is lasting for longer than 5 minutes, then you need to take them to the hospital because it's classed as an emergency.
You've talked about how what to do when a person is having an attack. Why is timing very important, and why shouldn't people? Because I've seen it where people are trying, when a person is having an attack and they're trying to put their weight on themselves so they don't move, holding them in one position. Why shouldn't people do that?
Because the thing is, like, the whole body has gone, the whole body is jerking, right? With epilepsy. If you're trying to restrain somebody, like you're doing more harm than good to them. The thing is with seizures, like as difficult as it sounds, you have to let the person have the seizure because the first phase of a seizure is that the body goes stiff. And then after that, and then you go into the tonic phase.
Yeah.
So the thing is, you just have to make sure that there's nothing around them that will hurt them. Allow them to have the seizure and then you make them secure and make sure you place them in the recovery position. That is the most important thing. And the reason why timing is so important is because for some people, their breathing gets affected. So, because at that point, you can't really do anything. You can't give them oxygen. You can't do anything that can help them. You just allow them to come out of that seizure, and then you can help them afterwards.
We had a question during the course of the week. Maybe you can tackle it. One lady
Yeah,
was saying she's already on treatment and she's been on treatment for the past
yeah,
15 years. But lately
yeah.
she's been going into more like a coma, which will last for more than 4 hours. Should she be worried? That was a question from one of our
Okay.
followers. Yeah.
She's been going into a coma.
Yes, she will collapse and just later on wake up after 4 hours. She won't be able to remember what really happened.
There's a condition known as non-convulsive status epilepticus. I know it sounds like a mouthful, but that's when the brain is seizing, but the person isn't seizing. So it's like, to you, it looks like the person's in a coma. But then what's actually happening is that the brain is in a constant seizing state. That is the most urgent referral that we get. Because I'll give an example. Like we get people who are admitted to intensive care who are in a coma. But then what's actually happening is that they're actually having seizure activity happening in their brain. So to me, that's what it sounds like. It sounds like she's having very prolonged seizures where she's not actually jerking, but she's seizing, like her brain is seizing. So in that case, I would advise her to go to the doctor because it might be a case whereby they might have to increase her anti-epileptic medication because that's something that's very concerning that you're losing that many hours. And if somebody isn't physically seeing her jerking, it might be that she's in non-convulsive, aka she's having seizures.
Having answered that, maybe now we can move management and treatment of epilepsy, because one lady had complained saying the brother has been taking
Yeah,
medication for the past 12 years. Is it a lifetime jail that this person will always be taking and they'll never get cured? Is there
yeah.
treatment? How do you manage them?
Pardon, say that again.
Is there any treatment to cure, or is just now managing the patient so they don't have more epileptic jerking?
It depends on what type of epilepsy that they have. I think because the thing is, what tends to happen over here with regards to management is that people get tried on one anti-epileptic medication. They start from like a low dose, and then they keep or gradually keep increasing it, because ultimately what you want, as soon as you prescribe somebody with anti-epileptic medication, then you want to, isn't helping, then they can prescribe an alternative anti-epileptic medication, and then they can also use anti-epileptic medications in combination. So it just depends on what the neurologist, who I'm assuming is the person who's managing that patient. If one is not working and they've maxed out that dose, then it might be worth trying a different medication, or trying two medications in combination. It's all trial and error until you actually achieve that seizure control. But then it depends on what medication is available.
I think we might have lost her. Are you able to get me?
Yeah, I can hear you.
Okay, I think the video is on mute more like. So are there any different types of management of epilepsy that people should know about?
Well, the first line of treatment is your anti-epileptic medication.
All right.
And then I think they try different types of medication. If it is that medication doesn't help, because the thing is, like I said, it is a trial and error. They start off on a starter dose of one anti-epileptic and keep increasing it. If that different types, if that doesn't help, there's this treatment which is like a ketogenic diet. For some people that helps. Cannabis oil helps as well for some management. And then the last resort, I think, is epilepsy surgery. But then that depends on the type of seizures that somebody's having. If somebody's having focal seizures and they can pinpoint, then epilepsy surgery is something that would be useful, because what they tend to do with that is that they cut out that portion of the brain that's causing the seizures, and then that tends to get the seizure control that's needed. So your first line of treatment is your anti-epileptic medication, and then other free if they can pinpoint where the seizures are coming from.
I'll try to take you back. So maybe let's say someone has just joined in late. Someone has joined in late. How do you perform first aid during a seizure to a patient who's having an attack?
Right. So when somebody's having a seizure, you just want to make sure that the surrounding area around them is safe. So you're trying to get rid of any sharp objects. You have to allow the person to have the seizure. You don't try to intervene, aka you don't want to put anything in their mouth. You don't want to be trying to be pulling out their tongue and any of these things, because then you might end up injuring the person whilst they're having the seizure. So the main thing is to make sure that they are safe, allow them to have the seizure, and then when they are done having the seizure, then you place them in a recovery position. So that's when you literally tilt the person on their side, and then you wait for them to recover and gain consciousness. And then once they are gaining consciousness, you start asking them questions. You can ask them questions like, oh, do you know what's happened? Do you know what your name is? Because after somebody's had a seizure, because it's involving the whole brain, they're going to be really confused. So do not, by all means, put anything in their mouth.
You had talked about the EEG. What is it, and what is it all about, and
Yes.
what goes on?
All right. Okay. So with the EEG, it's a brain test that we perform on the head.
Okay.
And what we do is that we place 21 electrodes on the scalp. So similar to an ECG, the one where they place all the stickies on the chest, this one we place the stickers on the head, and then from that we can record the brainwave activity. We tend to record for about 20 minutes. So with the EEG, it's a safe procedure. There's nothing going in, there's nothing coming out. It's just recording the brainwave activity on the scalp, on the surface. And then during the EEG, we tend to perform activation. So we do deep breathing, because like I said, with petit mal seizures, that can bring on their seizures. So that can be a trigger. So we do deep breathing during that test to see what happens to the brain waves as a result of the deep breathing. And then we also do some flashing lights frequencies, predispose them to having seizures. So that's what the test is. And from that EEG, we interpret it, and then the doctor does a final conclusion. From that EEG, you can tell whether somebody's got epilepsy or if they don't have epilepsy. And you can also seizures are coming from. So it's either that it's involving the whole brain, or it could just be involving a part of the brain.
Uh, I know we've now discussed everything. What would be your word of encouragement to, number one? I think for me, I'm more into pediatric at the hospital with parents who have children who are maybe going through uh, epilepsy attacks, and to just any person who's feeling stigmatized during this time. There's a story here in Zambia of a lady in Kalingalinga who lost the fiancé because the parents told him to say, this woman is demon possessed. If you get married to her, you will all die in the family. What would be your encouraging words to people who are going through, who have epilepsy, and especially to parents who are having a child who's having attacks? What would be your words of encouragement?
Yeah, so my word of encouragement is that they need to find, or they need to seek medical help, because epilepsy, like we're saying, is not something that's a result of demon possession. It's a medical condition, just like any other medical condition. And it's something that if you do manage it properly, they can live a normal life. I mean, if somebody's on anti-epileptic medication and that manages to control the seizures, then they can live a normal life. They can carry on driving, they can carry on working. So the sooner that it can be diagnosed and they can be started on medication, then the sooner they can live that normal life, or as normal a life as they can. And it's also one of those things whereby, like, if somebody's having seizures, you just want to get it addressed, because if you don't get it addressed and they carry on driving, for instance, and then they end up having a seizure behind the wheel, that's something that's not just endangering themselves, it's endangering everyone else as well. So it's something that they need to address quickly. Go to the hospital, get the medication, get those seizures under control, and they can live a normal life. So I just encourage, especially parents, they need to be more observant about their children, and they need to get these things addressed so that the children can be started on the medication. And the sooner they can get started, then the better the outcome.
Okay. It has been a learning. I've enjoyed. I've been trying to write notes so that at least I'm able to share with friends. We want to appreciate, during a busy schedule, you
Okay.
had found time to share your
Yeah.
passion and also increase the awareness about epilepsy. Any other closing remarks that you have for many people here in Zambia?
There's this charity, it's called Tele EEG. It was started in the UK, and the whole aim of this charity is to try and bring epilepsy awareness and epilepsy management to developing countries. So they came over to Zambia, I think that was in 2020, and they set up a clinic in Zambia. Unfortunately, the person who was leading the clinic passed away, but it's still something that I think it's a clinic that they are still trying to develop so that more people can have access to like these EEGs, this diagnostic tests. And so hopefully it's something that will be like just up and going, just something that people have access to, just so that they can have this test and they can better diagnose and better manage epilepsy. So I'm just hoping it's something that takes off, and people should just be aware of it, that that's a test that's available, and it's a test that they can access, and it's something that will help them to lead normal lives.
All right. Message Zambia is, we'll ask you a question. Message Zambia is only in Africa, but have you downloaded the application on
Yeah.
your phone?
Not yet, but I will after this.
Hope you share the word to family back in Zambia to also download the application.
Oh gosh.
MedSet Zambia is a platform that we've created for everyone. We have
I need to, because like we were saying, it's so, I think medical does not have as much of an audience as other things, because these are things that are relevant to people's lives. I mean, there are
very
people
much.
out there who have been living like in shame and in fear because they've got epilepsy. And the saddest thing about it is if they just got it seen to, if they had awareness about it, it's something that can be treated. So I do hope you get some more audience and some more people joining this channel and just more people getting their health seen to.
Thank you very much, Madam Chiwowa, for according us this time. I personally have learned a lot. I didn't even know that we have
Mhm.
International Epilepsy Day, which falls on every second month of
Yeah,
February. So this is something that we've learned and we hope
yeah.
to increase the awareness. MedSearch Zambia, for everyone who joined in our discussion, MedSearch Zambia is a platform that we created. We have developed an application called the MedSearch Zambia app that is helping you find the nearest health facility, be it a hospital where able to do your EEG, or be it a pharmacy where able to buy medication that will help someone who's living with epilepsy. Download the application, it's for free of charge. Madam Chiwawa, thank you very much for joining us. Here at MedSearch Zambia, we always
Thank
say
you for having me.
MedSearch Zambia, healthcare simplified. Good evening.
Message Zambia app. Healthcare simplified.